Cardiac medications from nature. And I get this question a lot. My patients sometimes come up to me and say, Dr. Allo, I don't want to take any medications. I just want to take natural substances. Well, the good news is most cardiac medications that are absolutely proven to help came from nature. I don't like prescribing medications, but if you need them and they're life preserving, then we have to use them. Sure, you can try weight loss and diet and exercise and all that stuff. And if it works, that's great. That's our ultimate goal, is to get you to live a healthy lifestyle. But sometimes your genetics is against you, or at least until you achieve those weight loss goals, we have to put you on something. So a lot of people don't know this, but aspirin, for example, the number one prescribed cardiac medication is willow tree bark. It comes from willow tree bark. Back in the old days, when people would have a stomach ache, they'd tell them to go bite on a piece of bark or a piece of wood and just sit there, and their stomach ache would get better. It is oil of wintergreen, or salicylic acid, or methyl salicylate. It's an excellent medication, reduces heart attacks and strokes, a pain reliever, fever reliever, lots of other uses for it. So it's a great anti-inflammatory and even works in IBS sometimes. Another cardiac medication is Coumadin. It's a blood thinner that works very well for people who have atrial fibrillation, for preventing strokes, or if you have clots in your lungs or your legs. It comes from sweet clover, little plant called sweet clover. Some patients say, well, no, it's rat poison. Well, yes, they did use it as rat poison, but it actually comes from a plant called sweet clover. The next number 2 most prescribed cardiac medication is statins, like Lipitor or Crestor or Atorvastatin or Rosuvastatin. They come from red yeast rice. We know that red yeast rice contains lovastatin, and that's kind of where it comes from. We found that it does have a cholesterol lowering effect. Now, buying red yeast rice over the counter doesn't always actually contain what it says, because it's not FDA regulated, not FDA approved, so we know it doesn't include that. Another one is EPA, or Vascepa. There's a medication called Vascepa that is actually a specific type of fish oil that lowers LDL and cholesterol profiles and improves all-cause mortality, we've found recently. So that's another huge one. Another one is ACE inhibitors. I'm sure you all know someone who takes lisinopril or captopril or benazepril or quinapril. All of these, and all these ACE inhibitors come from, guess what? This is probably the craziest one. It's not a plant. It's really bizarre. Take a guess. They come from viper venom. Yes, the snake, the viper, and they bite you. When a viper bites into you, it releases a bunch of ACE inhibitor, drops your blood pressure so low that you ultimately die because you're not getting enough blood flow or nutrients to your organs. That's kind of how it kills you. So that's very important to know. We obviously don't give it at such whopping doses, but we were able to purify that molecule and use it. And there's so many other countless examples, like digoxin, the heart arrhythmia medication that makes your heart squeeze stronger if you have a really weak heart, or slows your heart down if you have other rhythm problems, comes from the digitalis plant or the foxglove plant. People used to make salads out of these the leaves of the plant, and then they'd be like wiped out. They'd be like really slow and lethargic and tired, and their heart rate was dropping to the 20s and 30s, and this is why. So when your patients tell you, hey, look, I only want to take natural substances, these are all natural substances. And a lot of times my patients say, well, you know what, I only want to take stuff that's natural. Well, if the stuff you're taking was natural, let's say it's horsetail shavings or something. I don't know, I've had all kinds of stuff. If it worked, it would be the next billion-dollar drug. It would be FDA approved, and it would be a billion-dollar drug like Lipitor, Coumadin, digoxin. All these medications started from nature, but because they worked, they became prescription. They were highly purified, very tightly controlled, so you're not like overdosing on it, and they became prescription, the next billion-dollar prescription. Now, sure, you could say, well, someone's just trying to make money off this stuff. Well, the companies that sell supplements are also trying to make money off this stuff. Those things are expensive, and most of the time, when it's a medication and is generic, your prescription pays for it, it's much, much cheaper. Paying $2 to $3 or $4 at the most for a bottle of aspirin or digoxin is way cheaper than buying all these supplements that supposedly are for heart health or whatever it might be. So just keep that in mind. Definitely share this with your patients and friends. If they're concerned about natural substances or not sure where things come from, this is kind of where a lot of things come from nature.